Peptic ulcer. Peptic ulcer are the area of degeneration and necrosis of gastrointestinal mucosa which is exposed to the acid peptic secretion. Peptic ulcer compromise of gastric ulcer, duodenal ulcer. Etiology. Helicobacter pylori gastritis, a major cause of development of peptic ulcer. It is infection of Helicobacter pylori leading to chronic inflammation of the mucosal layer. NSAIDs induce mucosal injury. NSAIDs are most commonly used medication in routine treatment of various diseases. They are responsible for direct toxicity, epithelial injury of both gastric as well as duodenal mucosa. Dietary habits. Improper eating habit is regarded as one of the important factors responsible for peptic ulcer. Example: spicy food, chronic alcoholic person, malnutrition, tobacco smoking. Stress, anxiety, fatigue, tobacco smoking may lead to development of peptic ulcer. Genetic factors. To develop peptic ulcer, also occurrence of peptic ulcer are seen in which familia stories, and it is monozygotic twins. Pathogenesis. The gastric mucosa defense against the acid pepsin secretion gets impaired. Hyperacidity cause digestion of mucosal layer leading to ulcer formation. Helicobacter pylori gastritis is seen in around 90% of the case which break down the gastric mucosal defense. Gastric ulcer are found predominantly along the less curvature pyloric region of the stomach. Most of the duodenal ulcer are found in the first part of duodenum. Typically, peptic ulcer are single, rounded to the oval and characteristically punch out. Ulcer may vary in depth from superficial mucosal to deep mucosal layer. Clinical feature. People at risk. Abdominal pain, may lean, epigastrium ornate, hypochondrium, abdominal fullness, heartburn, peritoneal pain, regurgitation of stomach fluid into mouth, hematemesis, loss of appetite, loss of weight. Diagnosis is mainly dependent on the clinical feature of patient. Confirm can be done with the help of oesophagus gastroduodenal scopy, OGTP strip. It is the ulcer appearance as created with or without bleeding. Barium meal study. Helicobacterium pylori testing, mucosal biopsy, urea breath test, examination for N. pylori antibodies, polymerase chain reaction for H. pylori. Treatment. Dietic should be banned. No spicy food, no alcoholic, no smoking. Use of acid reducing medication like proton pump inhibitor, example omeprazole, rabeprazole, etc. H. pylori eradication therapy, combination of proper antibiotic with antacid for 14 to 21 days help in eradication of N. pylori infection. Clarithromycin plus thiazide and radirazole. Complication: gastrointestinal bleeding, perforation, gastric outlet obstruction, malignant transformation.